Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Thank you so much for joining me again today. For those of you who enjoy listening to our Rational Wellness Podcast, I would certainly appreciate it if you could go to Apple Podcasts or whatever podcast app you're using and give us a ratings and review. That way, more people will find out about the Rational Wellness Podcast. Also, if you go to my YouTube page, you can find a video version. And if you go to my website, drweitz.com, you can find detailed show notes and a complete transcript. Our topic for today is the use of bioidentical hormone replacement for men with Dr. Matthew Cavaiola. As men age, their testosterone levels tend to decline. Approximately 1 to 2% per year after age 30 or 35, depending upon the study. Though it's not clear that this is inevitable, since some older men do not experience this decline. We are also seeing a society-wide decrease in both testosterone levels and sperm counts in the U.S. Much evidence points to the cause being endocrine-disrupting substances in our environment, like bisphenol A, phthalates, PCBs, pesticides, glyphosates, as playing a role in reducing these male hormones. A study in the Archives of Internal Medicine in 2007 found that lower levels of anabolic hormones, which includes testosterone, DHEA, IGF-1, in men over age 65, is associated with increased mortality over a 6-year period. However, it's controversial these days whether having higher IGF-1 levels is better or worse for longevity. There are some studies recently that have shown that having lower IGF-1 levels is associated with improved longevity. Men with low testosterone levels may have a number of significant symptoms that are associated with a lower quality of life, including decreased sexual desire, erectile dysfunction, reduced strength, reduced muscle mass, reduced bone density, insomnia, and cognitive dysfunction, among others. The question we would like to answer today is, should such a man be prescribed androgen hormones like testosterone and DHEA? And what are the possible negative and positive consequences of taking male hormones like testosterone besides the ones your body naturally produces? Our special guest is Dr. Matthew Cavaiola, who is a naturopathic doctor. He also holds a master's degree in both human nutrition and acupuncture. He specializes in men's health and testosterone replacement therapy, and his practice is conscious human medicine in Santa Monica, which he shares with his partner, Dr. Hashemi. Dr. Cavaiola, thank you so much for joining me today.
And thank you for having me. Very much appreciated.
Excellent.
Great introduction.
I appreciate that. So let's start by defining, what do we mean by low testosterone levels?
So low testosterone levels, there's basically a clinical definition and more of a symptomatic definition. So when a male patient comes in and sees us at our clinic, essentially we evaluate the patient. First of all, understanding what's happening with the patient overall symptomatically, right? And again, you mentioned some of the symptoms that oftentimes are associated with low testosterone. The picture that they might present with is, I have fatigue, I have difficulties with libido, difficulties putting on muscle mass, or fat deposition or weight gain, those types of things, sleep disruption, and a whole variety of other things. So when they come and see us, it's important to, first of all, understand the root cause. As naturopathic doctors, it's important for us to get to the root cause of people's problems. So that is important for us. Okay, let's understand the symptom picture. And at that point in time, we may recommend doing some lab work. And so once we run lab work, the labs can come back and there's a the lab values, the reference values range for total testosterone from 250 to 1100. So, doc, that's a huge, huge range.
These are serum levels. You typically do serum,
correct,
right?
yes.
Okay.
So there are different measures of testosterone. There's different applications. There's different lab methodologies that you can use to evaluate testosterone. Serum probably is the gold standard and one of the best and kind of the most easily used for insurance purposes as well. So we typically use serum levels, and when a total testosterone level comes back between 250 and 1100, it's a huge range. So part of the problem that we're running into is that a lot of times men, depending on where they fall along that scale, they're being undertreated. And a lot of times, because as long as you're above 250, if you're at 251, you're considered normal.
Sure.
Right?
And some of the labs say the bottom range is 150 or
Right.
it changes
Right.
sometimes for age ranges.
Yes, exactly. So really we need to be looking at the entire picture, and that really is the key. So if a patient comes in and their levels are at 400 and they feel like they just feel awful, then there is a potential clinical reason for using testosterone for that patient. So we both look at the lab values, which again, the lower end of the scale is 250. So clinical definition of hypogonadism or low testosterone is anything below 250, although we need to be looking at the clinical picture plus the labs for the majority of our patients.
Okay, so what about free testosterone levels? Are lab measures accurate? I know there's some controversy about that.
Yeah, I mean, I think free testosterone levels are accurate, and that free testosterone, if people listening out there don't understand the differences between total and free testosterone, basically what you have is a total pool of testosterone that's being released from your testes, essentially, and also to a lesser degree your adrenal glands, which we'll talk about, I'm sure, in a little while. But your free testosterone basically is the proportion of your testosterone that is not either bound up to carrier proteins. One of the major ones is called sex hormone binding globulin, SHBG, albumin, or being converted into other things like estrogen, things like DHT. Those are the primary things that testosterone oftentimes is converted to in the bloodstream. So the free testosterone is basically the bioavailable proportion of testosterone that can be utilized by the body. It's very, very important. So although you may have a normal total testosterone, whatever considered normal is, you can have a lower proportional level of free testosterone. And that's problematic because that really is what's doing the magic in the body. So we want to have adequate levels of free testosterone. So we need to be measuring both total and free. So there is controversy about free testosterone because if we do put a man on testosterone replacement therapy, which we're going to talk a lot about today, free testosterone increases. At that point in time, it's not as accurate to measure. Basically, at that point in time, we want to be just looking at the total testosterone because essentially we're increasing endogenous levels of testosterone by injecting testosterone. So the free testosterone levels are going to go up.
Okay. And why are so you're saying looking at free testosterone levels is not as helpful? Why is that again? I don't quite understand.
So free testosterone is important when you first start running.
Right, but after you start adding testosterone.
Correct. So essentially what's happening is if you're injecting or using some other type of application of testosterone, taking in hormones into the body, right? So it's actually going to raise both your total testosterone and your free testosterone levels. So you're not getting an accurate representation of really what's happening inside the body. So really at that point in time, the free testosterone is relatively negligible in terms of measuring. We do it anyway just to kind of see what's happening overall with the entire picture.
Right.
But not as important at that point in time rather than the collecting of the baseline levels.
Right. Unless, of course, you don't see an increase in free testosterone because a lot of it's getting bound up.
Absolutely. Yes. Bound up or being converted into other things. So yes, in that case, like I said, we do want to see the entire picture holistically. And as people who don't just prescribe testosterone and get them in and get them out in our practice, we really want to understand what's happening overall with the hormone picture. It's really, really important for us to understand what's happening with estrogen, what's happening with DHT, what's happening with SHBG, and then what's happening with the patient overall.
And do you also look at estrogen and progesterone?
Yeah, absolutely. Estrogen more so than progesterone. There's some docs out there that really love to run progesterone levels.
I've even heard some docs prescribe progesterone for men in certain circumstances.
A few of them do, yeah, and really from a clinical standpoint, we're always more concerned about estrogen because of the negative side effects that it can have. There are less side effects associated with progesterone in men, and not maybe necessarily not as many men need progesterone compared to women.
Right. So when you look at estrogen, are you basically focused on the estradiol, or do you look into total estrogen?
We look at total estrogen in our practice, and really it's really important. Some people just look at estradiol alone, and what we're seeing actually is estrone E1 is a relatively potent form of estrogen. For your listeners out there, there's basically three types of estrogen. You have estrone, E1, estradiol, E2, and estriol, which is E3. And essentially, estriol is negligible. It pretty much doesn't exist. It's in very, very small amounts. Estrone and estradiol in the body, they both have similar effects in men and women. Obviously, women have more estrogen than men, and vice versa. So essentially, what we want to be seeing is not very high levels of estrogen total. And you had mentioned earlier the fact that we are taking in more and more exogenous, meaning outside of our body, estrogen nowadays, right?
Right.
We're being bombarded by it all throughout our environment. It really is scary, And so estrone sometimes is a measure of, not estradiol, of our exogenous estrogen exposure. So for instance, how much plastic water bottles we're drinking out of. And so plastic, of course, contains phthalates that we're taking into our body, we're ingesting orally, and then basically it get trapped into our body.
And by the way, it's almost impossible to avoid plastic. You can avoid plastic water bottles, and then you have some fish and you find out it's got microparticles of plastic in it.
Everything, we're turning into a plastic society, unfortunately. And there's not one person on this earth at this point in time who doesn't have plastic in their body.
Absolutely. And you pick up a cash register receipt, it's coated with bisphenol A, which is, one of the hardeners for plastic. And
yes.
Yeah. Do you look at DHEA levels?
We do. So as part of our routine baseline analysis for our patients, we're looking at total and free testosterone, both types of estrogen, DHT, DHEA, cortisol, SHBG. Those are the primary things we're going to be looking at for our patients. So yes, we look at both DHT, dihydrotestosterone, which is a byproduct of testosterone, and DHEA. Now, DHEA is interesting. It's an adrenal hormone like cortisol, and DHEA is interesting because I mentioned earlier in the podcast that basically you have two major sources of testosterone from the body. It's from your testes and also a little less from your adrenal glands. And you are going to get a little bit of production from your adrenals in the form of DHEA, converting into some of the other androgens kind of systemically.
Right. On the estrogen levels, isn't it important that the estrogen stay in a certain level? Like if the estrogen gets too low, that's not ideal. And then what level are you worried about? What's the range you like to see the estrogen in?
Very good. So great question. And what we'd like to see is the total estrogen, that's the combination of both estrone E1 and estradiol E2, being less than 100. That's our kind of cutoff point, our more of a danger zone, if you will, I suppose. But like you mentioned, if estrogen goes too low, we can also have effects. So men need estrogen. Yes. Men need a little bit of estrogen for bone protective effects, for libido a little bit. We need some estrogen for natural libido and for our erectile function. So estrogen shouldn't be lowered and bottomed out. In fact, I've seen clinically when we do that, men run into problems down the line. So we want the estrogen between roughly, I would say probably 30 total and 100. That's kind of our cutoff points.
Okay. That sounds good. So let's start with how you would handle a younger man, maybe a 30-year-old, maybe 40-year-old, who comes into your office and has symptoms of lower testosterone. Let's say you evaluate them, and maybe in one case they have low total and free testosterone. And, you know, what would tend to be your approach in handling this patient?
So first of all, I will just back up, and I think it's important to mention to your audience that we are seeing younger and younger men coming into our office with low testosterone. You know, it is no longer an old man's problem. You know, we really are seeing men in their 20s, 30s, and 40s who have low testosterone. So although our testosterone relatively peaks in our 20s and starts to decline after like you mentioned, around the age of 35, we are seeing men who have low testosterone at a younger and younger age, again, primarily due to our environmental factors. However, when a patient comes in, they're in their 30s or 40s, how we approach the patient is, first of all, understanding, again, the whole hormones in totality. Let's understand all of the hormones, what's going on from a holistic perspective, and then saying to a patient, these are the options. You know, we can start you on testosterone replacement therapy. We can start you on something that might be helpful in raising your testosterone levels outside of testosterone, or some combination thereof. And then also explaining to the patient that, you know, if they are interested in fertility, you know, testosterone has the capabilities of lowering your fertility levels. So we can talk more about that in a little while. But basically, if you take exogenous testosterone, essentially it shuts down your own production of sperm and testosterone. So
let's take the case of a guy, 35-year-old guy, and he says, look, I don't want to take any testosterone.
Okay.
I don't want to take any pharmaceuticals. What's your diet and lifestyle approach?
So diet and lifestyle is crucial. You know, obviously we want to be cleaning up the gut. You know, a lot of times as functional medicine practitioners, we start with the gut, we start with diet. You know, it is so vitally important to look at the gut as the root cause of so many problems that we have.
How do you analyze the gut, and how do you clean up the gut?
Great question. So a lot of times, you know, we look at a stool analysis to look for particles and look for things that might lead us to believe that there's what we consider intestinal permeability. We also do food sensitivity testing in our office as well, which can give you clues as to what's happening internally.
What type of stool test and food sensitivity testing do you tend to use?
So are you asking for brands, or are you asking for?
Sure, yeah, you can talk about brands.
So typically, I don't know if that's allowed on this podcast or not. So
yeah, there's no CEUs.
right. So a lot of times we'll run a Genova stool analysis, comprehensive stool analysis, CSA.
Okay.
And then, you know, we really like Great Plains food sensitivity test.
Okay.
And so what's important is getting these clues as to what's happening. You know, if the gut is permeable, we are seeing nowadays, and also looking at the microbiome to some degree, we're seeing more and more correlations between microbiome health and also hormone levels in the body. And if you can clean up the gut by repairing the holes that have been punctured into the gut, I suppose you could say, tightening things up so proteins are not leaking into the bloodstream, and also improving the microbiome, improving the health of the microbiome, that can actually help hormone levels long term. And then from a diet standpoint and a lifestyle standpoint, first of all, lifestyle, it's important that men they don't drink to excess, they do not smoke, they minimize their environmental exposures, because that really is a key nowadays, you know, more so than a lot of other things. And
what about smoking marijuana?
So smoking marijuana is controversial. You know, there's some people who say it does lower testosterone, and some people who say it doesn't. I'm in the camp of, if we can do whatever we can to maximize our hormone levels and kind of what the research says, then we should be doing that. I would say if you do that, don't do it to excess. How much are you doing to begin with? I think that's part of the battle. You know, if you're drinking every single day, you're going to have lower testosterone levels most of the time, right? If you're smoking every single day, a pack a day or a half a pack a day, it does cause lower testosterone levels. So those are things we can be doing from a lifestyle standpoint. And
I tend to think that the marijuana, I've seen enough evidence that it certainly, there's a fair chance that it may lower testosterone levels.
Yes, and there's actually a new study out, and there were studies before this too, but actually it's been linked to testicular cancer as well in men. So, that's not favorable for marijuana, unfortunately.
Yeah.
But, yeah. And then the other thing, we exercise is another thing that's very, very important to help to raise testosterone levels. Testosterone, there's a lot of, I guess you could say, controversy in terms of understanding what the best types of exercise are for men to raise testosterone levels. And we don't really know what the gold standard is at this point in time. As long as guys are getting out there and moving their bodies and doing strength training has been shown to raise testosterone levels. It doesn't matter.
Hasn't heavy resistance training been shown to be the most beneficial?
Strength training, heavy strength training has been shown to be beneficial, as has mixed training as well. So resistance training as well as some kind of cardiovascular aerobic training. Okay. And one thing that I really love recommending for my patients is HIIT training, high intensity interval training, which has actually been shown to be very helpful, not only to raise testosterone levels, but also to essentially help with a lot of cardiovascular and metabolic parameters too.
Okay.
So, and from a diet standpoint, we always start, obviously we only have a certain amount of time today for our podcast. We can go on and on and on about diet and nutrition, but I think starting with an anti-inflammatory diet would be the best way to go for the majority of people.
Which basically is what?
So an anti-inflammatory diet would primarily be, things.
There's many diets that people describe as anti-inflammatory.
Yeah, absolutely. So if somebody out there is listening who has never started on any kind of dietary program before, what we oftentimes recommend is avoiding the 4 or 5 big guns. That's what we call them. So, so something like dairy, gluten, sugar, absolutely. You notice how close I got to the camera. Sugar and corn and depending on who you are, soy.
Yeah.
Yes, absolutely. So soy has been shown to essentially kind of mimic estrogen in the body and to also unfavorably lower testosterone levels. So that would be a good starting point.
We've been having a great discussion, but I'd like to take a minute to tell you about the sponsor for this episode. I'm thrilled that we are being sponsored for this episode of the Rational Wellness Podcast by Integrative Therapeutics, which is one of the few lines of professional products that I use in my office. Integrative Therapeutics is a top-tier manufacturer of clinician-designed, cutting-edge nutritional products with therapeutic dosages of scientifically proven ingredients to help patients prevent chronic diseases and feel better naturally. Integrative Therapeutics is also the founding sponsor of TAP Integrative, a dynamic resource for practitioners to learn with and from leading experts and fellow clinicians. I am a subscriber, and if you include the discount code Weitz, WEITZ, you'll be able to subscribe for only $99 instead of $149 for the year. And now, back to our discussion. Besides doing those things, you've cleaned up the gut, you've got their diet doing better, they're doing some exercise. Are there any specific supplements that you have found to be beneficial?
Yeah, I mean, there's a ton out there. There's a gaggle of products out there that claim to raise.
Which ones work?
So things like Tribulus, that has gotten a lot of press, Tribulus, Maca, some of these things. And, having covered this for a bunch of times in presentations and research, they don't have any real benefit in men on raising testosterone levels. They may help from a libido standpoint, from a symptomatic standpoint, but they don't really cause any major bumps in testosterone levels. Now, one product one herb that I very much like is ginseng. I talk about it all the time. I used to teach at Bastyr University in California, and my students would just get sick and tired of me talking about ginseng because of how great it is for raising testosterone levels. But it also really is an all-healing kind of thing. That's what the prefix Panax means to begin with, is all healing. It has a really, really great effect in the human body. And I really like American ginseng from the perspective of raising testosterone levels. Korean ginseng and Siberian ginseng can also be helpful as well. But American ginseng is really, really great for raising testosterone levels.
Yeah, I personally have found maca to be beneficial, especially if they get sufficient levels.
Yes.
I think just taking a couple of capsules is not enough, but if they can get a substantial amount, like several tablespoons, and then what if they have reasonable or decent total testosterone but low free testosterone? Have you found anything? Let's say it's related to high sex hormone binding globulin.
Yeah. So interesting question. There are some things out there that we're recommending now to be able to, what we're trying to do is we're trying to uncapsulate the testosterone from the SHBG. The SHBG, as opposed to something like albumin, which is another carrier protein in the blood, SHBG, once it binds on testosterone, it does so very, very strongly. It doesn't want to let it go. So as men get older, believe it or not, their SHBG level goes up. And that really is a problem because it binds on more to free testosterone. So that's a problem. So what we want to do is we want to uncapsulate that. We want to get that SHBG off of the testosterone. And so to do that, one mineral that's been shown to do that is boron. Boron has some pretty good research on helping to basically kick off the free testosterone from SHBG. And some other minerals, magnesium, zinc, and then of course, good diet and exercise have also been shown to do the same thing.
Dr. Gio Espinoza, who's an expert on men's health, personal communication with him, he recommended stinging nettle root. And I've been trying that on some patients and we seem to see some effectiveness. Great.
Also a great product. And it also can actually help to possibly lower DHT levels in men too. So that's great.
Oh, okay.
Yeah.
Good. So now take the same 35-year-old who's willing to try some pharmaceuticals, but maybe doesn't want to get on testosterone because he's thinking about having a family.
Gotcha. Yeah. So very important factor. First and foremost, I will say that if a man, even in their 30s, starts on testosterone replacement therapy and wants to have a family at some point in time, testosterone replacement or the effects of testosterone replacement on fertility are reversible. So it is not permanent. It does take 3 to 6 months, roughly speaking, to basically get the body to start doing its own thing again from a sperm production. However, it is reversible. Now, there are some things you can do to combat that. Let's say a guy is on testosterone. What we've also been shown to be helpful is something called HCG, human chorionic gonadotropin. That's a mouthful. HCG. It's actually a hormone that's typically found in highest amounts in pregnant women. Both men and women have some to a certain degree. What's interesting about HCG is it basically is an LH agonist, meaning that LH is a hormone produced by your pituitary gland, and LH is the signal to your testes to produce testosterone. So the subunits of HCG look like LH to a certain degree, and it actually causes your body to produce a little bit of its own. And in doing so, helping to raise sperm levels. So HCG can be used in combination with testosterone to help to improve fertility. If that being said, if a guy says, no, I don't want to do either one of those things, you can take HCG solo to raise testosterone and help with sperm production. Or there are some pharmaceuticals out there, something like Clomid, which has been shown to be helpful, and a lot of docs are becoming privy to Clomid to be able to raise testosterone levels and sperm counts. So interesting.
Yeah, I know Dr. Howard Elkin, he was discussing this with me, and he was saying he often will recommend for that type of patient a combination of Clomid and HCG.
Yeah, good.
When they use HCG, how long do they use it for before they see an effect?
So it's not going to be as immediate necessarily as testosterone. It's going to take a little while longer, but at the same time, and it's not going to be to the same degree that testosterone works. You're going to get a small bump in your testosterone levels as opposed to taking exogenous testosterone. It just doesn't work as well, but you can usually notice an effect with probably in about a month to a month and a half, I would say.
Okay. Since we talked about these endocrine disrupting substances, do you ever try to get rid of those with some sort of a detox?
Yeah, absolutely. So detox is crucial, especially if we find that your estrone levels are high. We're like, well, there probably is some kind of exogenous estrogen coming into the body, right? So how do we get this out of the body? That's crucial. And I'm sure in your practice, you work with your patients a lot in terms of detoxing.
Yes.
And, a lot of people think of detox as this weird, magical, foo-foo kind of thing. And it's not just about drinking juice on a daily basis. It's really about purging the body of harmful chemicals. And essentially you have basically 4 main ways of getting rid of stuff from your body, whatever that is. Sweating through your skin, poop through your intestines, getting it purged from your liver, and also through your breath. And so those are the major, and through your urine, 5 major ways. So you have to get it out of your body. So first of all, you need to mobilize, and then you need to get rid of it as well. So if you have, let's say you have a bunch of phthalates stored in your fat tissue. First, you need to purge it from that fat tissue. You need to unglomp it from your adipose. So one of the main ways to do that is heat. And we use far infrared sauna in our practice to be able to do that. So heats at a deep level, far infrared sauna, and purges those phthalates out to be able to be excreted through your feces or your urine. So you need to make sure that those, what we would call emunctories, are open so that you can get rid of them, right? So you need to be pooping properly. You need to be urinating. You need to be drinking water, which a lot of people just do not drink enough of. I would say 80% of our patients come in and they just don't drink enough water. So water and making sure that you're eliminating properly are really crucial for getting rid of that stuff once you've unlocked it.
Okay. Do you ever consider the factor of sleep in terms of testosterone levels?
Absolutely. So sleep is crucial for so many things in your body, and one of the major things is, helping to recharge the battery once you're sleeping. That's what sleep is all about. And what we oftentimes see is patients who are chronically sleep deprived or who work night shifts, and people who just are stressed out to the max. Why that's important is that basically it's a stress on your body, right? Any kind of stress like that prevents you from basically recharging when you're sleeping. And secondarily, it kills your adrenal glands. And the adrenals are, like we mentioned earlier, a poor proportion of the testosterone that you're going to release on a daily basis. So we need to make sure that your adrenal glands and you're sleeping properly. Absolutely. So, 8 hours of sleep a night or whatever it is that you use as your litmus test for the amount of sleep that you need is really crucial to be able to heal.
Okay, so now you have a man who has hypogonadism, i.e. low testosterone, and he's interested in taking the recommendation to get on testosterone. What's your preferred type of testosterone you like to utilize?
Great question. So first and foremost, we use something called bioidentical hormone replacement therapy. So bioidentical meaning it's like the hormones that are found in your body. So what's great about bioidentical hormones as opposed to synthetic hormones is that your body takes them in and recognizes them as self. So it doesn't really have to do anything with it, doesn't have to synthesize it or be overly processed by your liver, takes it in and can utilize it right away. It's like, oh, thank you so much for these extra hormones. We very much appreciate it. And so there's different applications that you can use of testosterone. We're going to typically prescribe something called testosterone cypionate, CYPIONATE. Cypionate, that's derived primarily from soy and yam, mostly yam, not as much soy, which is a problem for some people. And so what we do is...
And this is something that you take by injection.
Yeah, so there's different applications. There's injections, there's creams, and then there's pellets. And so we found that creams are helpful to a certain degree. It is a daily application, so getting people to be compliant on it is always a problem, and making sure that people are doing enough of it is also a problem, and making sure there's no transference where there's kids in the family or transferring to a partner is not going to be a problem. And so they work relatively well, but again, you need to be doing enough of it to make sure that you get a benefit.
And where do you tell them to apply it?
So typically you can apply it twice a day or mostly at nighttime.
And to which part of the body?
So you're going to apply it to non-hairy skin. It's just best easily absorbed when it's on non-hairy skin. And there are some doctors out there that say to apply it to the gonads, to the testes. Please don't do that. It's just you're applying testosterone to an area that's very androgen sensitive to begin with, and we've seen a lot of people end up with prostate problems or further atrophying of their testes because of it. So don't do that. And so the other thing is we can also do pellets as well. Pellets are a small little amount of testosterone implanted under the buttocks of the skin. It's a minor surgical procedure. And essentially, we've seen that, unfortunately, it should last between 3 to 6 months, depending on how much they put in. And we see a lot of times what ends up is that men get a huge dose at the beginning and not as much at the end. So they feel great at the beginning, or they actually have too much on board at the beginning and they kind of have some negative side effects, and then not as much in the beginning, they feel like crap.
So you mentioned testosterone cream. What particular product do you like? Do you use androgel? Do you use compounded products?
That's a great question. And so some of the pharmaceutical derived testosterone products out there, first and foremost, are messy, they're expensive, and they oftentimes don't work because they don't have very much in them. So you need to use gobs and gobs of it to get clinical benefit, as opposed to something like a compounded version of testosterone that we get from a compounding pharmacy, where we can specify how much testosterone we want per milliliter or per gram so that we can make sure that the patients are getting enough. That really is crucial.
Okay, so what about androgel?
So androgel, I've had patients who have been on it, and they come in and they say, this doesn't seem to be working. And when you run the lab test, it verifies that. Their testosterone levels they're not really seeing a large increase in their testosterone levels, nor are they getting any better. And that really is the worst thing. It's a double whammy. So what we oftentimes recommend is a bioidentical form of testosterone that we can better control and the patients get more of a clinical benefit.
So what percentage of your patients are on topical versus pellets versus injections?
So patients who come see us, the majority of them, 90%, 95% are on injections.
Okay.
And about 5% are on creams.
How often do they inject?
Injections typically vary depending on who the person is. If they have very, very low levels of testosterone, sometimes they're injecting weekly. Most of the time they're injecting weekly. And if they are somebody who utilizes it very quickly, and you can only really understand this if you start a patient on testosterone, they don't really notice a benefit, or they're bottoming out towards the end of their injection cycle, meaning 6 days or 7 days. We sometimes do injections twice a week, which does help a lot of patients. So it's typically twice a week to weekly.
Does taking testosterone increase or decrease cardiovascular disease? I saw one paper that showed increased coronary artery plaque that resulted from taking testosterone from 1 year. This was a JAMA article. Yeah,
that was a JAMA article. And unfortunately, the JAMA article was, I think you're speaking of the article in the for frail older men.
Yeah.
And so this was the study that came out and there was a subsequent study that came out as well that kind of had a similar finding. And what we're seeing is that was in frail older men who are people in the VA system, VA healthcare system. And you are partially correct. The research says that there's a slight uptick in the risk of having a coronary artery event if during the first part of testosterone replacement therapy in older, frail men. I will just say that. Now, there's been subsequent studies that have come out that have completely debunked this and basically said, not true. Basically, yes, there is a small uptick in your risk at the start, but overall, testosterone has a positive benefit for cardiovascular health. And it's a positive benefit for metabolic health. And it's a positive benefit for so many other things, including, like you mentioned earlier in the introduction, for lowering all-cause mortality. That is the key, and improving quality of life as you age. So the study, if you really break it down and look at the percentages, what they showed was the men who were in the testosterone replacement group, it was a smaller group than it was the non, and the proportions were actually lower than for the people who had cardiovascular events. It was actually lower in the testosterone replacement group. So you need to kind of crunch the data. You need to look at the data and really analyze some of these studies a little bit closer so you can understand what's happening. And we don't want this to get a bad rap. And it did, unfortunately. For 3 to 5 years, testosterone was all over the place. There was lawyers who were having a field day with this. There's commercials on TV. Did you have a coronary artery disease? Or have you been on testosterone replacement? And so, but it really scares people, and we need to kind of put the positive spin on things to say, this was in one population group only.
There's actually an interesting relationship between testosterone and cholesterol, isn't there?
Absolutely. So there's been so many studies that have come out looking at this, that fact that testosterone improves cholesterol markers just by doing that and that alone, not even dietary modification. Testosterone lowers LDL, it raises HDL levels, and it can lower total cholesterol as well. So
and actually, if you lower your cholesterol levels too low, right. Cholesterol is actually the backbone molecule that your body uses to make testosterone. Absolutely.
So all these guys who come see us who have been put on statin medications, and they've been on them for 5, 10, 15, 20 years even, oftentimes we see these guys with low T, and low thyroid function and low everything production, because cholesterol, like you mentioned, is the backbone. It's making virtually every hormone in the body. So it's really, really important.
Now we know that testosterone increases red blood cell production, so hematocrit levels go up. So how do you handle this?
Great question. And so what we're seeing, so really, I would say this doesn't happen to every single patient.
How often does it happen?
I would say maybe 10% of the time. 1 out of every 10 patients, you're going to run into some kind of difficulties with this. And really,
And what hematocrit level did you measure? Is it hematocrit that you monitor for this?
Yeah, I'm not going to. I don't know the exact values right now while we're speaking, but what I would say is making sure that it's within the reference range. That's really important, right? And of course, monitoring things over time. That's why it's really important for us to understand the patient to begin with. What are their hematocrit levels to begin with, baseline, and then measuring every 3-6 months so we can understand what's happening with the patient. We want to do our due diligence. We want to be ethical. We want to make sure that the patient's safety is protected at all times. So when this does happen, there is a risk for hematocrit causing the blood to become sticky. When it becomes sticky, there's a risk of cardiovascular events. That's what we're concerned about. Or throwing a clot. That's basically what can happen, right? And so what we do in these particular cases is basically have the patient undergo routine phlebotomy, have them give blood, and usually the hematocrit levels come down pretty quickly.
Right. Does taking testosterone increase or decrease the risk of prostate cancer?
Well, it depends on who you are. If you have pre-existing prostate cancer, testosterone replacement therapy is not necessarily the best idea for you. That's pre-existing. However, how many men out there know that they even have prostate cancer to begin with? Because it's such a low-grade, slow-growing cancer that oftentimes we just don't even know until it's clinically diagnosed. Or diagnosed by a biopsy. However, the research basically shows that testosterone actually has a prostate protective effect than it does causing prostate cancer.
So let's say a man comes in to see you, and as part of your screening testing, you do PSA levels. What level PSA would you be concerned about whether or not you should put him on testosterone?
So I don't want to speak on behalf of every single patient who comes in, because of course we always want to look at the patient, right? But I would say anything less than 4, which is the kind of the cutoff point, would be kind of worrisome at that point in time.
Right. Let's say you had a guy with 3.5.
I wouldn't be concerned, probably. And again, given if there was no symptomatology, if we did a prostate exam and everything was normal, there was no nodules or masses found, we'd be less concerned.
Okay. And so you have a man with prostate cancer. chronic stage, would you ever consider administering testosterone?
I would highly consider it. Yes. Would I necessarily do it all the time? No. I mean, I think there may be some other ways that we can raise testosterone levels rather than doing testosterone replacement therapy.
Would you ever do it?
I think this is something to kind of consider on a case-by-case basis with each particular patient, depending on the severity of the case. If it's a stage 1 or in situ kind of situation, you're probably not going to be as concerned than it was if it's metastasized to the bone, and that's just not a good sign.
Right.
Yeah.
When you administer testosterone, do you ever recommend certain supplements at the same time to make sure that the body processes the testosterone optimally?
Yeah, I mean, in the way of like preventing side effects, or
yeah.
Okay, yeah. I mean, certainly there are some products out there that can be used. For instance, there's a product called Chrysin, which is essentially derived from the plant passion flower, and that has been shown to be helpful to lower estrogen levels. So sometimes we do Chrysin alongside of testosterone replacement to help to mitigate the effects of estrogen on the body.
Okay,
yeah.
Good, excellent. So I think that's a wrap for today.
Wonderful.
Any final thoughts you have, and then give us your contact information so patients out there can find out about you and your services.
Thank you so much. Yeah. So I think what I would say to wrap it up is, if you are struggling with the symptoms of these types of, symptoms of low testosterone, if you think you have it, do not be afraid to talk to somebody about it. I think so often is the case where we as men do not go see doctors because we're afraid of what we're going to find out. We're going to think that we're less of a man if we have low testosterone, or we're scared of doctors. Whatever the reason being, please go see somebody about it. Go see somebody who's going to look at you and understand your case and really take the time to listen to you. That really is crucial, and that's what I would leave you with today. And so don't wait before it's too long, before it's too late rather. Okay, so if you are interested in kind of more of our services, you can visit our website at www.conscioushumanmedicine.com, CONSCIOUS, human medicine.
How did you come up with that name?
It's really important to us. If you kind of break it down in terms of the name, of course, medicine stands by itself, but we are passionate about all of us becoming more aware of who we are as human beings and our health, being conscious, being present. And it's important for us as well as practitioners to be conscious. We don't want to just blindly see people who come into our office and just give them supplements and send them on their way. It's about a two-way street. It's about having great relationships with our patients, being human.
Excellent.
Yeah.
Thank you, Dr. Cavaiola.
Thank you so much for having me today. Very much appreciated.
Excellent. I'll talk to you soon.